Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, we've got a packed episode today. 8 stories covering everything from clinical care to cultural insights, tech trends, and even some eye-opening policy moves.
Right, we're kicking things off with a new push to tackle sepsis in long-term care, then diving into infection risks, opioid safeguards, and some pretty promising innovations.
And later on, we're looking at how diverse cultural perspectives are shaping what it means to age well, plus a few watchdog updates on fraud, insurers, and community oversight.
Let's get into it.
So, sepsis. It's still one of the biggest threats in senior living communities, and now there's a fresh push to tackle it head-on.
Yeah, IPRO has launched this Train the Trainer program as part of their hashtag Stop Sepsis Now campaign, and it's really designed with long-term and post-acute care in mind.
If you're not familiar, IPRO is a Quality Innovation Network Quality Improvement Organization, or QINQIO. They work under CMS to improve healthcare outcomes across settings, and this sepsis initiative is part of that mission.
What's smart about it is that it doesn't just drop a bunch of materials on you. It actually equips frontline staff, like nurses and aides, to teach others in their community how to recognize and respond to sepsis early.
Right? And we know that early detection is absolutely critical. Especially with older adults, the signs can be subtle and delays can be deadly.
They've got resources like learning modules, checklists, posters, all ready to download and use. Plus, they're totally free.
And HealthCap has free tools too. We've got cut-and-carry pocket cards, sepsis posters, and even a webinar that's accredited by both ANCC and NAB. All of it's available in our resource center.
Yeah, it's a great 1-2 punch. Use IPRO's training to build your in-house team, and then reinforce it with HealthCap's materials to keep the message visible and consistent.
And this isn't just for the clinical team. It's meant to be multidisciplinary, so dietary, housekeeping, admin. Everyone plays a role in spotting the signs.
Exactly, and in communities where turnover is high, having an internal trainer keeps that knowledge alive and consistent.
What I like is how practical it is. It's about building a culture where sepsis awareness is second nature, just like fall prevention or medication safety.
It's a good reminder that education is prevention, and that's something every community can act on today.
All right, shifting gears a bit, have you seen the latest ECRI report?
Yeah, and McKnight's long-term care news just covered it. One thing that jumped out right away: long-term care facility-acquired infections are now listed as one of the top 10 patient safety concerns in the country.
It's a big deal. ECRI's list is nationally watched, and when infections in senior living communities make that list, it's a wake-up call.
Right, and they're not just talking about COVID anymore. This includes urinary tract infections, respiratory illnesses, skin infections, things that can easily spiral without quick intervention.
Exactly. And what ECRI points out is that many of these infections are preventable with strong infection control practices, which means we've still got a gap to close.
One of the challenges they highlight is staffing. When teams are stretched thin or undertrained, infection risks go up. It's not just about having protocols, it's about making sure they're followed consistently.
And that's hard when you're onboarding new staff every week. We need systems that are easy to teach, easy to remember, and supported from the top down.
It's also about communication. Even things like documenting changes in a resident's condition or flagging early symptoms to the nurse can be game changers.
Yep. And this connects right back to that sepsis conversation. Recognizing early warning signs and acting fast can prevent both infections and their complications.
So if you're in leadership, this is a good time to revisit your infection control policies and ask, are we really equipping our staff to succeed?
And are we auditing for compliance? Because having a binder on the shelf isn't enough. It's what people actually do day to day that matters.
Exactly. Infection control isn't just a clinical responsibility. It's a community-wide priority.
Another article in McKnight's focuses on how senior living communities are addressing opioid use among residents.
Yeah, and it ties in perfectly with what we talked about last week around overdose preparedness. This is the prevention side of that same conversation.
Exactly. The piece highlights James Balda from Argentum, who says communities are implementing safeguards like regular medication reviews and targeted staff training.
Right, and with so many residents on complex medication regimens, those reviews are key. It's easy for opioid risks to get missed without a structured process.
They're also encouraging more non-opioid pain management strategies, like therapy, mobility work, or even just more frequent reassessments of pain sources.
And it's not about cutting opioids completely. It's about making thoughtful, individualized choices that prioritize the residents' overall well-being.
Especially in communities without on-site clinical staff, those partnerships with pharmacists or outside providers become really important.
And like we mentioned last week, having naloxone on hand is a good safety measure. But ideally, we're building systems that prevent it from being needed in the first place.
Exactly. That means training, audits, communication. It's about creating a culture where opioid use is managed proactively, not reactively.
So if your community is looking at overdose preparedness, this is the natural next step, getting ahead of the risk through smarter prescribing and oversight.
All right, let's talk tech. PharMerica just released a new report outlining the top technology trends shaping senior living in 2025, and there are some practical developments worth paying attention to.
Yeah, and what really stood out is how these tools are being used to support staffing challenges and improve clinical outcomes in real, measurable ways.
One example is predictive analytics. It helps identify subtle health changes in residents before they escalate into something more serious.
That kind of foresight allows teams to intervene earlier, which can lead to fewer hospital transfers and better continuity of care.
The report also covers how telehealth and virtual care have become more integrated, especially for communities in more remote areas or those without around-the-clock nursing.
And robotics are being used in creative ways, from automated med cards to robotic companions that help with social engagement.
What I like is the emphasis on using technology to support staff, not replace them. It's about freeing up time so caregivers can focus more on resident interaction.
Exactly. But for that to work, the tech has to actually fit the workflow. If it adds more steps or confusion, it ends up being a burden, not a benefit.
PharMerica stresses that point too. Success depends on having strong leadership, clear goals, and the right training in place.
And speaking of training, it's not just about knowing how to use the tools. It's about understanding why you're using them, what outcome you're aiming for.
So if your community is exploring new tech this year, this report is a good place to start. Look for solutions that ease the pressure on staff and support better resident care.
It's all about alignment, making sure your tools, your team, and your mission are all working together.
This next one comes from the Mather Institute, and it's part of their ongoing research series exploring what it means to age well. This edition focuses specifically on cultural perspectives.
Yeah, the report is called Aging Well Across Cultures, and it builds on their earlier Aging Well studies by diving into how people from different racial and ethnic backgrounds define a good quality of life in later years.
What's interesting is that while aging well might sound like a universal goal, the way people define it really depends on their cultural values and lived experiences.
Exactly. For some, it's about independence. For others, it's about strong family connections or spiritual fulfillment. It's not a one-size-fits-all concept.
The report highlights how senior living communities can use this insight to offer more personalized, inclusive care, starting with how we talk to residents about their goals.
And it goes beyond care planning. It's also about programming, dining, even staff training, making sure the environment respects and reflects the cultural identities of the people living there.
They also point out that many older adults from underrepresented groups don't see themselves reflected in senior living marketing or leadership, which can impact trust and engagement.
That's a big one. Representation matters, not just in the brochures, but in who's making decisions and shaping policies.
And it's not about getting everything perfect. It's about being intentional, asking questions, listening, and adapting when needed.
So if you're in a leadership role, this report is a great prompt to re-examine how your community defines person-centered care and who's included in that vision. Because aging well isn't just about what services we provide, it's about how well we understand the people we serve.
Next up is a policy story from McKnight's, and it's about how some states are taking a harder stance on insurers that consistently block or slow down access to care.
Yeah, state lawmakers are introducing measures that would penalize insurance companies for what they're calling inappropriate care denials, especially when those decisions interfere with timely treatment.
And for senior living communities, this is a big deal because when residents need something like rehab or wound care and it gets held up, the window to intervene can close fast.
Right, delays in authorizations can lead to worsening conditions, unplanned hospitalizations, and even increased liability for providers.
The article notes that some states are proposing fines, audits, or public reporting of insurers with high denial rates. The goal is more accountability and fewer unnecessary roadblocks.
It's also a sign that the prior authorization process is under a lot more scrutiny. Many providers feel it's more of a financial filter than a clinical one.
And older adults especially can't afford to wait days or weeks for decisions that affect their health outcomes.
So this could lead to stronger protections for residents and better clarity for providers navigating the reimbursement process.
If you're managing care coordination, it might be time to revisit how your team tracks and appeals insurance decisions. The more proactive you are, the better the resident experience.
And as this conversation evolves at the state level, communities that document their challenges could help shape what reform looks like.
Let's move into another regulatory story. This one's also from McKnight's, and it looks at how federal fraud enforcement is staying strong, even as some healthcare regulations are being rolled back.
Yeah, according to the article, the Department of Justice and other agencies are continuing to prioritize healthcare fraud, especially in sectors like long-term care.
And that includes everything from billing issues to improper kickbacks to documentation that doesn't support services billed. It's not just hospitals. They're watching senior living and skilled nursing closely too.
One of the big takeaways is that even though we're seeing some deregulation in healthcare, enforcement isn't slowing down. If anything, it's getting more focused.
Right, especially with the use of data analytics. Agencies are using claims data and audit trails to flag outliers and look for patterns that could indicate fraud.
And the consequences are real. Civil penalties, exclusion from federal programs, even criminal charges in some cases.
It's a reminder that compliance programs need to be more than a binder on a shelf. Communities should be actively auditing and educating staff to prevent issues before they happen.
Exactly, and leadership needs to set the tone. If the culture is to just do what you have to do to get reimbursed, that's a red flag.
So even if some requirements are being relaxed, the risk environment is still very much active. Providers need to stay sharp.
Because enforcement is shifting from blanket oversight to laser-focused investigations. And long-term care is definitely on the radar.
All right, our last story comes from the Iowa Capitol Dispatch, and it looks at why the federal government's Special Focus Facility program is still on pause.
Yeah, if you're not familiar, the SFF program is designed to identify the lowest performing senior care communities in the country and put them under increased scrutiny and support.
It's essentially a watch list that flags chronic issues in quality of care, staffing, or compliance. And when it's active, it provides transparency for families and accountability for providers.
But right now, the program isn't functioning. The Centers for Medicare and Medicaid Services hasn't updated the list or enrolled new communities in quite a while.
That's a problem, not just for oversight, but for public trust. Families rely on that information to make informed decisions, and communities that need help aren't getting flagged.
And the article notes that while CMS has said they're reviewing the program, there's no clear timeline for when or if it'll restart.
Meanwhile, underperforming communities can continue operating without that extra layer of monitoring or support. That's a concern for resident safety and systemic improvement.
It also leaves a gap in transparency. If a community has a long history of citations or serious deficiencies, the SFF list would normally bring that to light.
So, for senior living leaders, this is a reminder to be proactive in quality improvement. Don't wait for outside oversight. Engage your teams, audit your systems, and raise your own bar.
Because even if the federal spotlight isn't on right now, accountability to residents and families should always be front and center.
That's going to do it for this week's HealthCap Weekly Wrap.
Thanks for tuning in. And whether it's improving sepsis awareness, embracing tech, or navigating policy changes, We hope you found something helpful to take back to your community.
For more details on all the stories we covered today, be sure to check out the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
We'll see you next time.
Have a great week.